Hello, my name is Patricia Williams, and this is cerebral palsy. So, what exactly is cerebral palsy? Well, first of all, cerebral is having to do with the brain, so anything with the brain, that's what the word actually means, and palsy means problems with the muscles. So, together, it is a disorder in which the brain's control of the muscles is limited, which basically this means that the brain cannot control the muscles as well as most normal people can. So it affects all types of muscle movements, and the severity of each case varies. Which someone with cerebral palsy might have trouble speaking, they might have trouble walking, they might even have chronic pain. And that leads us to the characteristics of cerebral palsy, which could either be muscle stiffness, coordination and balance, or uncontrollable movements. The symptoms widely varies actually. Muscle stiffness can actually cause problems in walking. If the muscle is stiff, that means that the muscle tone is not exactly balanced. It can vary either too much muscle tone or too few muscle tone. If it's stiff, it's too much muscle tone. And if legs in the muscle are too stiff, that could cause problems walking. Maybe if you see someone walking with cerebral palsy, they walk kind of with like a limp because their muscles aren't able to work fully. Seizures, if their muscles contract because of the muscle stiffness, that's also a big problem. And speech with the brain cannot control the mouth's movements, and that causes problems in speech. Coordination and balance can cause people with cerebral palsy to be unsteady when they walk, to trip and fall easily. And that's a big problem that we as teachers need to look out for. Lastly, uncontrollable movements with hands and feet or sucking and swallowing, especially in the face. If the brain cannot control the muscles, it is very hard for someone with cerebral palsy to bring their mouth together and to suck and to swallow. Okay, so prevalence of cerebral palsy. Worldwide, there are about 18 million people, but in the United States, there's about 800,000 adults and children with cerebral palsy living currently today, and that's out of about 330 million people that are in the United States living. It is actually the most common disability that you will see. About 3 in every 1,000 children born are actually going to have cerebral palsy. There are currently 500,000 under the age of 18 living with cerebral palsy. So if you think about it, 500,000 under age 18, that leaves only about 300,000 over the age of 18, which is that gap, meaning that they probably won't live as long if they are diagnosed with cerebral palsy. And there are about 10,000 infants diagnosed every year. About 80% of people who have CP have spastic CP, which means that their muscles contract more and they're more inclined to seizures. About 30% of people with CP also do have epilepsy. So here are some causes of cerebral palsy. And prenatal, which means before birth, the mother might be infected with some disease or anything, and when that happens, the baby actually creates more proteins called cytokines, which can actually lead to brain inflammation in the womb, and that causes brain damage. Okay, and also viruses like chickenpox, anything like that, any problems with the mother can actually translate to a brain injury or gap in development, which causes CP. And also any thyroid problems from the mom, any injury from the mom, and also genes. Now, during birth, if there's a detachment of the placenta, that can also affect and cause CP, or if there's umbilical cord complications, if the umbilical cord is wrapped around the neck, causing a lack of oxygen to the brain, which also causes brain damage. Also, multiple births. The more births you have, the more likely you are to have a child with CP. CP is just a shortened version of cerebral palsy. And then postnatal is after birth. If they have a low birth weight, that can also cause cerebral palsy, prolonged jaundice, injuries after birth, which anything that causes a brain injury has the possibility of causing cerebral palsy. And then lastly have infections. Okay, so assessing and identifying CP. So doctors and specialists pay close attention to the milestones, basically meaning every 6 months a baby is supposed to be this far along in their life. Like maybe they have to be crawling by a certain age, by maybe like 12 months or something. And the doctor will be paying close attention to those milestones. And if there is a gap or a delay in development, they will be paying even closer attention. It is actually a long process to identify CP because there might be other movement disorders that it might be the root of instead of cerebral palsy. So that is why doctors usually take multiple visits just to rule out that they don't have that they're not misdiagnosing the problem. Some of the telltale signs are unusual postures, slow motor developments, and abnormal muscle tone. Okay, and so we also have instructional and curriculum strategies. So in the classroom, CP does not affect a child or a student's mental capacity. They are just as bright as everyone else. They just might have a movement disorder. So that being said, you should probably incorporate assistive technology like voice recorders or iPads. If they have cerebral palsy in the hands, it might be harder for them to type or to write. So you can use a voice recorder so that they can record their notes, or an iPad to be able to touch things easier. You should also create space in the classroom for easy mobility, create bigger walkways so that they don't trip and so that they have an easier time getting to and from their seats. And you should also have less sharp objects so that just in case they do fall, they do not hurt themselves more than they actually do. Okay, and then you should also encourage participation with group work. A lot of times other students might not include the student that has cerebral palsy in their group, so just create group work so that they feel included, because this is nothing that is their fault, and they are just as capable as doing the school as everyone else. So create group work that doesn't require as much movement, but that does encourage participation. You should also be able to use larger math manipulatives, just so they will be easier to hold and to use. Also, another idea that I had was squishy toys for people or with students with cerebral palsy in the hands, so that they can work their muscles a little bit, and that just in case their hands move a lot, that they can be doing something with that. Another thing that I think that you should consider is having your visuals easily accessible. Someone with CP in the legs might not be able to get up as easy to maybe view the board or something, or to move around to see the board. So I think it's important to keep that in mind and to make it as easy as possible for them to be able to see your posters or anything that you have written up on the board easily without having to get up and down frequently. Okay, and then we also have support groups. So this first one is Cerebral Palsy Group, and it helps find therapists in speech, in physical, occupational therapists, anything like this. It'll help you find therapists that you need for your child or for even yourself if you have CP. It also helps find you special education services if it's either public or private. Whether you're sending your kid to a private or public school, or even if you're homeschooled, they also help with that. And they offer general support for the whole family. And then we have this one, which is the Cerebral Palsy Clinic at Texas Children's Hospital. And here they offer a lot of specialists. And you have everything really in one place so that you don't have to be traveling to one clinic and the other clinic. It's all just combined into one. And they have a lot of expert advice so that people are well advised, so that they know what's going on, so they know the best thing to help their child that has CP. They also offer surgical options, as it is a clinic at the hospital. So if sometimes if a student has cerebral palsy, they might be able to get surgery to help them increase their mobility and other things like that. Okay, and then here are my references. Thank you.